A lot of what happens is when people are discharged from treatment, they feel that they often have a fear of recurrence of the cancer happening. There's often like a negative spiral into things like anxiety and depression, and there's a need for patients and their carers actually to be supported after the discharge and to live well and past their cancer. So the HOPE programme, which stands for Help to Overcome Problems Effectively, was originally developed as an evidence-based programme, and it was co-created with Macmillan Cancer Support and patients and their carers to try and address some of these unmet needs. The idea behind it was to rather than that negative spiral, to try and increase that positive spiral using things like goal setting, mindfulness, gratitude, hope, and things like that, components like that, and also behavioural elements like physical activity, nutrition and things like that, improving that side of things and coping. Improving patients' quality of life is a really important aspect, because without that you can help to treat and improve patients through their treatment and through the therapies that they're going through. But then after that, without the improving quality of life, they're living beyond the cancer treatment for many, many years now in some respects. And it's about trying to not just improve the quantity and extension of their life, but the quality of the life that they're living, and reducing their anxiety and depression, and meaning that they can communicate well with their families and their healthcare professionals, and also to cope more and live as someone that has had cancer or is living with cancer continuously, and that's something that needs the acceptance and the ability to cope with it. Implementing the HOPE programme has been a process over the last 7 years. Currently it's been a face-to-face 6-week course that's offered to patients, and there is a shorter course that's also offered to carers. It's implemented across the board. It's licensed and delivered by Macmillan. Macmillan also train facilitators who can be healthcare professionals and patients or carers to deliver the course. But one of the issues that we've had is that it's not consistently delivered. So there's a bit of a postcode lottery going on, and obviously we want to try and reduce these inequalities and improve the implementation across the country. So we've had we've talked to a range of regions about where they're having challenges and how they've overcome them, and some of the successes that they've had.